So we have two speakers. So Dr. Sergey Polevikov, he is the co-founder and CEO of WellAI, and for over 20 years, Dr. Polevikov has been a leading industry quantitative researcher and portfolio manager with extensive experience in managing client money with factor, alternative risk premia, smart beta, multi-asset solutions, and tactical asset allocations. So he is currently the board director at the Society of Quantitative Analysts and a committee member at the Key Group, two prominent national education organizations in quantitative finance. So I would like also to introduce his colleagues. So Dr. Daniel Satskov is a co-founder and machine learning lead of WellAI, and he is also the president and a lead researcher as a fiduciary fintech startup Rextremia. And Dr. Statov, together with the rest of the research team, is a winner of the 2015 Peter Bernstein Award, awarded for the reverse stress testing, the best article in any industry leading institution investor journals. So I think that there is a lot of, he received a lot of awards, but I don't know who will speak first. How can you manage? Can we share the presentation, gentlemen?
Thank you, Dr. Gajot. My name is Sergey Polevikov, and I have here my partner and co-founder of WellAI, Daniel Sachkov. So thank you for inviting us to this great event. The topic of our presentation is comprehending hundreds of thousands of COVID-19 studies using mathematical models of language and AI. And first, I would like to talk a little bit of our company, what we do. So WellAI is a digital health platform, and it's been designed for both scientists and commercial use, in particular to empower patients and also to make the work of doctors much more efficient. So you can use it in a commercial application as a simple application on a smartphone, just the way you use it, Apple Siri or Amazon Alexa. You can just talk to it, and it essentially draws from over 30 million medical studies that you find on PubMed. So it's essentially every time you have a symptom or a question, it draws from this vast database of medical studies. And the WellAI application has many uses. In this particular talk, we will talk about our COVID-19 application, but we will also touch on other topics as well, because as you can imagine, if you have this great knowledge of 30 million plus medical studies, you can apply it very widely. It's been a challenge for us because for the system to understand human language and to map it to medical concepts, it's been quite an amount of work that's been done. In particular, we managed to create our own database of over 4 million medical concepts. And for this particular COVID-19 tool, we used about 61,000 of them that are particularly related to the COVID-19 and SARS coronavirus problems. And obviously, we spent a lot of time on validating our models. We use various machine learning algorithms, resampling techniques, as well as real doctors that were independently asked to provide certain symptoms and diseases, and then we would test against our machine learning models. For the COVID-19 tool, as I said, it's been a very interesting and timely application, and we released our tool on April 7th of last year, shortly after the outbreak, and we made it available globally at wellai.health/COVID, as I pointed out here. And we worked with a number of great researchers. A lot of them are associated with the IFCC. to some extent. And in fact, we were honored to become members of the AI and genomics research group under the auspices of the IFCC. This particular research was published at the Electronic Journal of IFCC in June 2020. So you can check it out online as well. It's a free publication. This is how the tool looks like when you access it. We basically mapped all 69 UMLS medical disciplines as identified by the National Institute of Health. And so this, you see here only 2 of them, genomics and amino acids. But if you're a researcher, medical researcher, you can find any application. And the idea was that you can perhaps narrow the scope of your research to the disciplines that are perhaps more directly related to COVID-19, and perhaps make your research, if you like, more applicable to the COVID-19 problems. When we submitted our publication, the editors were asking, well, how is it different from regular academic searches like PubMed or Google Scholar? And our answer is that it's very different because it doesn't just search, it already knows which medical concepts are related to each other, which have high probabilities to address particular issue. And obviously we've done a lot of work on mapping and conceptualizing things like symptoms and correlated concepts. And so when you search for hypertension, for instance, in this application, it knows that it's the same as high blood pressure, for example. So it's the idea was to relate particular medical concepts and not necessarily just provide basic research. So it already knows and summarizes the results. We spent a lot of time on accuracy. In the medical literature, you have to be careful when you talk about the so-called symptom checkers. First of all, the sample size is important. Usually researchers in this area are talking about only 30 to 50 vignettes or diseases. We spend a lot of time making sure that our models are robust, and in terms of accuracy, obviously we want to use larger samples. So we have about 250, a little bit over basic diseases, and then we resample. That allows us to increase to some extent our validation sample to over 2,000. In fact, this research study by Cannon et al. Last year, 2020, pointed out that you have to be careful when you talk about accuracy, because every time you increase the sample, as they show here, your accuracy obviously drops. And now I'm going to turn to my colleague Daniel to talk a little bit in depth about the details of the WellAI application.
Thank you, Sergey.
Thank you.
I just want to start out by saying what I'm going to cover here. We're not from your field. We're data scientists, and probably based on the biography, you could hear that we work mostly in finance and in data science. So in finance, data science is very well developed, and it's got some unique problems. It solves some unique problems with data. But we've been interested for a long time in looking at particularly genomics, but other medical applications of data science. And so why do we exist? First we started talking about mathematical models of language. I know to many people it may sound strange. I mean, language is this flowery, poetic thing, and math is supposed to be more strict, but in reality that's not so. We will see that mathematical models of language are very, very useful. I will briefly go over just what these models are, kind of what they do, and then we'll get into some big picture stuff of how we think they can help you. When I say you, I mean very generally. I think almost any field, whether you're working in genomics or some other type of research, there's always you always can use these models to help augment your research, to give you kind of extra superpowers. So, but let me take a step back and describe what we see as the big problem that we're solving, right? What is the big problem? Well, the big problem, quite simply, is data. I mean, there are some data points on the slide which tell you how much data is generated in the world. And if you look at genomic data, I mean, that's just incredible amount of data. I think that as computer scientists and math geeks, we can tell you that it is very clear to me that this data is completely overwhelmed the ability of any bioinformatics or anybody to deal with this. I mean, we can all try to make a happy face and and talk about, you know, some research here and there. But in general, it seems to me when I read the studies that this data is just overwhelming the ability of the community, scientific community, to analyze it. And we feel like that there needs to be a solution. So first, the problem is, you look at the genomic data, well, overall data is clearly there. When we were in finance, there's also a lot of textual data that's relevant to finance. I don't know if you're following the news, you know, look at the, for example, the GameStop saga. I mean, just the social media data itself, the textual data has relevance to finance there. So in medicine, as we said, for example, a PubMed, that's not the only source, but that's millions of articles. There are thousands of articles coming out every day. I mean, is anybody reading them? I mean, I'm sure some are being read, but many of them, I guess they're being written for those who write them and for the reviewers. And that's a problem because there must be some good articles there. And so, and this is all unstructured data. And vast majority of medical data is unstructured data. And a lot of it is language data, not mathematical data. So I think when you think data science, typically you think numbers, right? Numbers. And if you think of data science genomics, well, let's put together some mathematical models analyzing genome. But we actually are taking a completely different approach. Not that it's not either or, but we will explain to you why this approach is important. So first, I want to establish that there's a huge amount of data out there. And genomic data is just one part of it, but think of the textual data, the human knowledge that is out there, that is completely overwhelming us. It's going by, thousands of articles get released every day, and we don't know, actually, maybe there's some treasure that we're missing. Next slide, please, Sergey. So this is very clear. It's on, you know, on a log scale, the amount of data that we actually use, if you look at the studies and the data that's being used, is only about, you know, 0.02% of available data that actually is being comprehended. And that's a big problem because the data tsunami is just going to get worse every year or every month. Next slide, please. There's a lot of uses of natural language processing, so NLPs, natural language processing, programming, sorry, in medicine. You know, there's named entity recognition. It's fairly trivial use. It's out there. There's also so-called medical chatbots, which is kind of a strange thing that I don't think will ever work properly. Medical history annotation. Then there's some diagnostics, but go to the next slide. Those are all really trivial. Now, before I talk about how we look at things and why we think it's useful for you, let's just quickly go over the foundation of natural language programming, and we'll go quickly through these slides, Sergey. So, believe it or not, in the ancient history, like in the computer science, 2014 is ancient history. Long time ago, somebody realized that you can actually fit mathematical models on a language. And so in the English language, what was found out amazingly is that mathematical vectors actually keep a lot of the properties of the language the way we use it. So if you take a vector, mathematical vector for king, subtract the vector from queen using simple, you know, kind of algebra, it's actually, the difference is the same as vectors between vectors men and a woman. And the next slide, please. And so similar kind of semantic relationships hold in math between capitals and cities. So you have USA, Washington, Russia, Moscow, Japan, Tokyo, and Turkey, Ankara. It's actually going to be similar. I mean, the example shown is just a, you know, vector with the dimension of 2. In reality, when we build the models, we have vector of dimension 300. So every medical concept, every gene, every nucleic acid, every protein gets assigned this 300-dimensional vector from the studies. Next slide, please. And so it actually knows more complex relationships. You know, we're talking so far about, you know, very, very simple model, not the kinds that we use, but even those simple model understand that petroleum, oil and gas, and country, town, and village have a similar kind of hierarchical relationship. Next slide, please. And then there are much more complex models. So you'll use, you know, Google or Google Translate, and whatever. These models are actually far more complex, but they use the same underlying idea. Words are encoded as vectors, and then various math is done with them. Because remember, we find that different concepts in the language actually hold, the mathematical relationships hold. And so there are so-called transformer models. These are really complex models that are used. But the core is the same. Language can be expressed as math, and we can help tackle a problem. How? Go to the next slide, Sergey, please. Before I go any further, I do want to make one point. So, and it's a very strange point to make from somebody who's like a member of AI, in our even name of our company has the word AI in it. But remember, artificial intelligence is not intelligent. And in fact, neural networks have nothing to do with, they're not neural. And deep learning, if you use this term, there's no learning. So those three things you have to remember. There's no intelligence in artificial intelligence. There's no learning in deep learning, and there's no neural networks. Why? How can I prove this? I'm just going to show, this is a little bit for humility, right? Because everybody who does AI now claims to save the world with it, and I don't think that's going to happen. I will show you how it's useful, but first let me show you what it doesn't do. This is an interesting example. It's not from language, it's actually from computer vision, but the models employed are very similar. See, on the left, we have a neural network that recognized the panda, right? It recognized the panda with almost 60% confidence, not very high. But what turns out that you can actually take these neural networks and you can apply just very little noise, but in a very targeted way using some calculus to trick the model. All of a sudden, picture on the right also has a panda, right? For any human, it's clear that it's a panda, yet the model with almost 100% confidence thinks it's a gibbon. So the point about from this example and from many other such examples, they're called adversarial examples, is that neural networks or artificial intelligence or deep learning, they're not really learning, right? Because learning is a generalization of concepts. You have to generalize to learn. That's what humans do. So I'm a big proponent of humans. I just want to say that when you hear this is snake oil, when you hear a lot of this nonsense that what AI can do, how it's intelligent, how it will replace humans, it is not going to happen. This is a simple example. Now, of course, you can build more complicated neural networks to cover for this example, but they get much more complicated. And the point is just the fact that this example exists shows you already that there's no generalization. So if it doesn't learn, if it's not neural, what can it do? Next slide. What can we do for you? I do think that, and we're not biologists, so I apologize if we mess up some terminology, but there is a field apparently, right? I really like the name systems biology. I'd like to even redefine it possibly. If we're not arrogant, right? We look at things as a system, right? Even the genome, the more I read about it, the more I understand it as a mathematician, it looks to me like an object-oriented program. Whereas I think most models that we apply right now in the scientific world, they actually look at it as not object-oriented, but like a linear program. And so, linear program is very simple, A causes B, B causes C, and so there's very linear relationships, and almost everywhere we try to fit these kinds of models. Why? Because that's kind of, really what our math allows. The math right now cannot deal with the amount of data, right? And I will say that there's an example from chemistry that we took as inspiration. There was an article in Nature where they used mathematical models of language, very simple ones, to actually predict qualities of materials. That was amazing. It's very simple but amazing. If Sergey, if you go to the next, can you go to the application for a second? I'm going to wrap it up and explain to you, kind of bring it all together. Can you go to the website, Sergey? Is it possible for you to? Yeah, so this is a live website. Remember, you can use this, wellai.health/COVID. It's free. We're not charging for it. But if you scroll down, Sergey, scroll down a little bit, you'll see that what we've done is we took hundreds of thousands of studies that you cannot possibly read, and we use these models to categorize them. So, and to really clusterize the concepts. And now you see that, for example, in gene, I can see here the genes that the models suggest are somehow related to the selected concepts. And what are selected concepts? COVID-19 and SARS coronavirus. Now, you can take, for example, let's say you're studying a gene and you take the fifth one, Sergey, and click on the plus sign. You can, if you click on the plus sign, no, not here, sorry, go back. Click on the plus sign. See now on the selected concepts on the left, now we have three concepts, COVID-19, SARS, and that particular gene. TAC STD2. So now it comes up with a new set of related concepts. If you scroll down, can you show the different categories on the right on the right pane? Amino acids, chemicals, nucleic acids, and so on and so forth. So in other words, what we've done is we absorbed lots of literature that you cannot possibly read, and we digested these relationships, complex relationships between entities, and we're showing you here what these relationships are. And you can take any number of entities, put them as you're given, and then see what are other relationships that it suggests. And more likely than not, some will be obvious to you, but some will not be. And that may suggest to you that, hey, here's a relationship that we missed. And we believe that in the long run, using models like this is what can help us deal with this immense amount of data. Because now we're not just starting anew, we're actually using lots of research that was done already. We're extracting all these relationships. And all of a sudden we can create a much more robust model because we know the entities that are related. And we have, I forgot, it's like 60 different categories of entities in birds, actually. Here you go. When we can stop at birds. So to summarize, mathematical models of language, in our opinion, are some of the most important scientific tools for 21st century. Why? Because the only way we get knowledge is we can only look at humans. Math models will not give us knowledge. But humans put out research every day, but yet very few people can read this research because there's so much of it. And we believe that these kinds of models can help you, whatever field you work in, you can go in and actually find related concepts, find more and more suggestions about what to do. And we're going to put out a more general model too for scientists, not just for COVID. And if you work in other fields where it's interesting for you to analyze literature this way, we're always looking for new interesting collaborations. You can ping us. There you go. Here's the contact data. And thank you for your time.
Thank you so much. So it's too fast probably because you know that there is a lot of concept that we have to assimilate. But thank you, Daniel, thank you, Daniel and Sergey. It was a very impressive contribution to these sessions. So I know that also you are specialized in finance. Probably it could be very useful for IFCC. Okay, so thank you so much.